Want to know the latest technologies in bariatric surgery? Let's dive in. Frequently during patient visits, we have discussions about the technique we use for weight loss surgery. What we're going to focus on here is the sleeve gastrectomy's technique. The technique is based on a stapler that divides the stomach. Usually we remove about 70% of the stomach or more with our surgical technique. The way we perform the surgery is using a stapler that staples the stomach. The stapler is powered, and what that means is that my fingers control the stapler, which opens and closes the stapler, and then moves the stapler in different directions so we can get the perfect fit for the appropriate sleeve gastrectomy that we're doing. The stapler can move in several different directions just based on the buttons I push with my fingers. So how does the stapler work? The stapler is like a standard stapler like you would imagine. It closes, and then there are 3 rows of staples on each side of the tissue that is divided, and then a knife in between that cuts the tissue. So we'll show you an example here on how that works. So here is a sample stomach. We're going to open our stapler, and we are going to fire the stapler across the stomach here. And if this is a standard stomach, you can see that this is about where we would remove for a typical sleeve gastrectomy. And so what we typically do is put a device into the stomach called a Bougie, and that's how we size the stomach to create the typical pouch size for a patient. The stapler then goes across the stomach like this. We fire it down, and then it fires across the actual stomach tissue like that. And then actually cutting through the tissue after it's been stapled, and then that's what's left behind. Here is a sample of what that looks like, and there are 3 rows of staples here and here. This piece is what's going to be removed, and then this is what stays behind. And the staples have this absorbable material which helps prevent bleeding. The staples are varying in heights, and the reason is that you want it to be sequentially more and more thin, and that allows better compression of the tissue on the stomach. What that does is prevents it from leaking and prevents it from bleeding. Patients will frequently ask about the staples that are used to do a sleeve gastrectomy. Are the staples permanent? Yes, the staples are permanent. They don't rust. They're there permanently. What are the staples made of? Staples are generally made of a titanium metal, and they do not absorb. Do the staples set off metal alarms? No. Generally, the staples don't set off metal alarms. How big are the staples? Here's a view here, and this is multiple staples. The staples are tiny and not like the typical staple you would imagine that would be used for stapling paper. Do the staples rust? The answer is no, they don't rust. How long are the staples needed? Your body grows into the staples after they've stapled off the stomach, and that becomes part of your body. And that process takes on average approximately 6 weeks for the staple line to fully heal. Another topic is staple line reinforcement. Staple line reinforcement is this extra, I guess I'm going to call it fabric, that is on the stapler. I'm not going to get into the details of the chemical makeup of it, but the fabric is absorbable, and it's there to assist the stapler in creating a staple line that prevents leakage and prevents bleeding. We've done a lot of studies looking at the benefit of having this staple line reinforcement, and studies have generally shown that the best thing it can do is prevent bleeding. There's been mixed results on whether it does help with preventing a leak or not after surgery. One thing that patients often ask about is the complication of a leak. Since we're talking about stapling, we talk about leaks from the staple line. The leak rate in a standard patient runs extremely low. My personal experience or leak rate is 0.01%, so it's a very rare event, but something we do talk about in the office when we review the sleeve gastrectomy. How do we know how much stomach to remove when we perform the sleeve gastrectomy? Typically, we use a calibrating device to tell us the size of the remnant stomach what we want to leave behind. That device is called a Bougie. A Bougie, which is a calibration tool, is a malleable plastic tube that goes inside the stomach. The tube is basically a certain diameter tube so that we know how much stomach is left behind after surgery. That calibration tube allows us to standardize our technique for performing the sleeve gastrectomy so that every patient has the correct amount of stomach left behind. We generally leave about the same amount for every patient. That way we have standardized results for all patients. If this is a diagram of your stomach, we typically will put the bougie inside of the stomach here while you're asleep. And then we use that as a gauge to decide how much of the stomach to staple. And so what we do is staple along here, and then this portion of the stomach, which is about 70% of the stomach, is removed. Some technical details about that. Sometimes if this is where the stomach ends, there are multiple studies looking at how far away from this area do we start to perform the surgery. And most of the time, if we start less than 5 centimeters or so, we can create adequate weight loss for the patient. As we perform the sleeve gastrectomy, what we do is adjust the stapler to the appropriate area of the stomach. We slide the stapler onto the stomach, and then we close it. And the bougie usually sits right in this area. And we basically fire the stapler along the bougie, like that. And again, this is 3 rows of staples on each side, and then a cut in between the staples. And then the stapler then comes off, and then there's the second fire of the stapler there. And that process is repeated all the way up the stomach, and then this part of the stomach is what gets removed to perform the sleeve gastrectomy. The bougie sits in here as a sizer, and then that tells us how much stomach to actually leave behind. In regards to how the stapler works, once we fire the stapler, this part of the stapler is disposable, and so this part gets removed after surgery. This goes in the garbage, and then we apply a new load here sterilely during surgery. The average staple load we require is somewhere around 5 staple loads approximately to come across the entire stomach. During the operation with the stapler, portion is all sterile. This is all reusable, and then we have a disposable staple head, which is what this is. So typically we would insert the staple head into the stapler, and this is all electronic now. It used to be all by hand, and this is just a godsend. So basically what we do is we load it onto here. This piece is disposable after it's been used. But there's different brands of stapler that are out there. I've been using this particular stapler now for probably over a decade. And personally, for my technique, it's the perfect fit. Every surgeon gets used to their own tools and their techniques. And what's important is that your surgeon has something that he does the same way every time, because by doing that, your team in the OR knows what you're doing. And then also you avoid mistakes and you have a more efficient operation. Any operation that a surgeon does, they should do it the same way every time, as long as it's providing good outcomes. But with this, it's a very fluid movement, the way the stapler works. And so it's like an extension of my hand in how it staples. And so that makes it a very fluid movement to go in and allow the operation to occur. And as my hand comes in to perform the surgery, it just slides right into place, and it goes just like this as it comes in. And just we fire, and very smooth motion to staple off the stomach and remove the stapler. And as the stapler comes off, your hand gets used to it, and you just pull it out, and it straightens out as you're done with it. So it's a very fluid, comfortable movement. And that's what is important, to have a safe operation that runs efficiently and safely with high quality outcome. A frequent question is, how long does surgery take? The time it takes to perform a sleeve gastrectomy is surgeon dependent. As surgeons gain experience and comfort levels with surgery, their time requirements for an operation will generally decrease. The average time that it takes for me to personally perform a sleeve gastrectomy is about 20 to 30 minutes operative time. And that operative time does not include the time it takes for a patient to go to sleep or wake up from surgery, but the typical operative time once we start surgery is approximately 20 to 30 minutes. A very common question that arises is what to do with a hiatal hernia that's found during surgery. So first of all, what is a hiatal hernia? A hiatal hernia is when part of your stomach slides a little up into the chest. And they can have varying degrees of size. If this is the stomach here, and then this is where the stomach and esophagus meet, that's called the GE junction. A hiatal hernia is where your stomach slides a little bit up into the chest. Because the abdomen is here, the chest is here, and when that slides up there, it can cause problems with acid reflux disease or regurgitation. So during the sleeve gastrectomy, we do look for a hiatal hernia. Most of the time we're aware of them before surgery based on the workup that patients go through. And usually an upper endoscopy or an x-ray will show us the hiatal hernia. But if we do find a hiatal hernia, we typically fix the hiatal hernia. Patients ask, why fix a hiatal hernia? The hiatal hernia can cause acid reflux if left unrepaired. Another complication is once you do the sleeve gastrectomy, if the hiatal hernia is big enough, it's possible that more of the stomach will slide up into the chest and cause problems. As a general technique, I always look for a hiatal hernia and repair that as part of the surgery. For more information about bariatric surgery, click the link below.